Welcome, my name is Samantha Schwartz. In this video, Chelsea Irvin, Alexis Starling, and I will introduce you to smart inhalers, a new technological invention that will revolutionize the way in which we utilize technology within the medical field today. Smart inhalers were developed to fix two widespread problems among medical professionals and patients alike. The first, medication non-adherence. The second, improper usage. By the end of this video, you will be able to answer the following questions. What is a smart inhaler? How is a smart inhaler used? Why do we need smart inhalers? What are the benefits? Who will benefit? And what are the implications of this new technology?
Smart inhalers are monitoring devices that contain sensors that attach to existing inhalers, which detect inhaler use, then transmits that data. Bluetooth technology is used to automatically record information about when and where a patient's used their medication. It also reminds patients when to take their medication and gathers data to help guide care by enabling doctors to see the data on their patients' inhaler usage, which can allow them to have more productive conversations about identifying issues and how to manage their illness. The smart inhaler sensor activates when the inhaler is pressed, setting into motion a process that records the exact time and location of the patient's asthma attack on a smartphone app. Doctors can view this data and see not only how frequently the patient suffers from attacks, but also better identify the environmental factors that cause the distress. These high-tech inhalers not only record doses, but also use gyroscopic and acoustic sensors to check medicine flow while monitoring the environment for allergens such as pollen. The app offers several features: a diary that tracks potential triggers, peak flow, and symptoms, notifications for upcoming or missed doses, and a percentage of prescription adherence, and a badge system for users, which rewards them for certain good behaviors. It also warns you when your connection between your sensor and your phone is lost, in case you have accidentally left your inhaler behind. This technology is important because the degree of compliance with inhaled drug therapy in patients with asthma and COPD does not surpass 50%. Studies have found that patients make at least one mistake during inhaled drug intake as often as 70% to 90% of the time, resulting in only 7% to 40% of the drug being delivered to the lungs. Easily recording inhaler use with this device not only helps patients and providers monitor adherence, but also corrects any errors when dispensing treatment.
Hello, this is Alexis. Some of the benefits of the implementation of smart inhalers include the increase in adherence rate, the management of lung diseases, and the effectiveness of prescribed medicine. With the constant reminders via Bluetooth on wireless devices, individuals are more likely to follow their prescribed routine dosage. In smart inhalers, the inhaler sensor monitors the adherence of each dose, and because of that reminder, the compliance rate among all patients who have smart inhalers has increased. Studies have shown that young participants are more likely to take their medications as to those without technology because of the set reminders and monitoring of expected triggers and asthma attacks. Smart inhalers not only increase the adherence rates, but also aids in self-management and clinical treatment in which the patient and provider both benefit. By monitoring the usage and adherence rates of patients, clinical providers can develop treatment plans catered to the patient's daily routine, which could improve the patient's quality of life and avoid prescribing the wrong dosage. Patients can also benefit through self-management, in which those who are aware of their triggers may be better equipped to know when to take their dosage and even connect virtually with their clinical provider. With both the active participation of the patient and the provider, there has been a reduction in preventable emergency hospital visits, hospitalizations, and also the unnecessary suffering. As mentioned before, there has been a reduction of hospital visits because of the smart inhalers. As a result of monitoring the number of asthma attacks and usage of smart inhalers in a geographic area, researchers can track the hotspots and trends over time. This gives us a better understanding of whether the cause of asthma attacks stems from the environmental factors or the lack of adherence. The reduction of cases and hospital visits can aid in decreasing the amount of healthcare spending for an uncontrolled patient who doesn't adhere or comply to their daily usage. Overall, smart inhalers give us a better understanding of how to treat lung diseases and reduce the amount of preventable asthma attacks each year.
Thank you for watching our presentation on smart inhalers. Here are 2 questions to aid you in further discussion on the topic. First, what are the possible implications of the dangers associated with smart inhalers for patients? And the second, how does this new technology have the power to revolutionize the United States healthcare system as we know it?